NHS Greater Glasgow and Clyde has a huge pool of terrific talent and access to some of the finest facilities and resources in the country. But it's the values and attitudes we demonstrate as individuals that make the biggest difference to patients and their families. Listening to patients is important. It's the patient experience that tells us what is working well and what could be better. We work hard to capture feedback. In the last year, more than 13,000 patients, their relatives or their carers gave us their feedback about using our services. It's testament to the quality of care and the dedication of our staff that more than 90% of that feedback was positive. Quality improvement and patient-centred care is at the heart of what we want to achieve.
Obtaining patient feedback can have a direct benefit on patient outcomes. It helps create a safe clinical environment where patients and their carers are listened to, their concerns are responded to.
We're committed to delivering our ambitious mental health strategy by investing in community-based services and also improving inpatient facilities. This has seen significant ongoing capital investment in mental health facilities on the Garts Naval Campus in Glasgow. And in Greenock, we opened the Orchard View unit on the site of Inverclyde Royal Hospital to provide the highest standards of continuing dementia care for older people. This is making a real difference to the quality of life for patients and their relatives.
Because it's a modern, lovely modern building, it means a big difference to all of us. When my daughter comes and her family, they come, and the boys come to visit their granddad, it's just wonderful that it's a lovely, bright hospital, modern, clean, and the fact that they're in their own rooms, just a big difference.
Integrating health and social care is a real priority. It's at the heart of putting patients first and wrapping more services around the needs of patients close to their homes. This is about much more than just bricks and mortar. But to deliver the very best quality of environment for patients and staff, we're delivering new custom-built health and social care centres. Maryhill Health and Social Care Centre has opened, and in the Gorbals, on the south side of Glasgow, a new centre is rising up from its foundations. In Western Bartonshire, a community-based nursing team was at the heart of changing the way vulnerable patients needed to access their treatment.
People from Western Bartonshire were not able to travel up to Glasgow to access treatment for hepatitis C.
With them opening it up local, it's made it easier to travel to, and it made a big difference. It actually gave me the courage to go through with my treatment, and I got to know the staff as well, which made it a lot easier to be able to talk to. And if I couldn't make it for any reason to them, they would come to my home.
It's great for us as a team because we can now see that our services are benefiting people's lives. They can now be treated locally for their hepatitis C.
It's made me basically want to live again.
This sort of service development is at the heart of health and social care integration, bringing care closer to home and delivering better outcomes. Sometimes the best possible care can only be done in specialist centres. Drummer Gordon Wilson made his name with Glasgow bands, Love and Money and the Blue Nile. But today he's banging his drum for the wonderful skills and techniques of the robotic surgery team in the Queen Elizabeth University Hospital. Last year, this new procedure was perfected to deliver massive benefits to prostate cancer patients. Precision and less invasive robotic surgery has meant that 200 patients this past year have avoided the many and serious complications that can result from traditional open surgery. Gordon was able to leave the hospital 2 nights after his tumour was removed. A speedy recovery saw him return to his drum kit in record time. His surgeon, Imran Ahmad, is seen here operating the Da Vinci surgical robot remotely. There is a compelling case for continuing to evolve our health and social care services to meet new patterns of care, demand and opportunities for new treatments and technologies. And our staff will continue to be guided at all times by our 4 core values in providing high quality, person-centred care.